And now to Uganda. The controversial proposal to replace Ugandan doctors with Cubans, the Cuban doctors that is, might not materialize soon. This is according to Uganda's Minister for Health, Dr. Ruth Aceng. According to Dr. Aceng, Cabinet has not yet made a final decision on the plan to import over 200 doctors from Cuba. The move is aimed at reinforcing Uganda's medical workforce, especially in rural areas, and that move has elicited strong reactions and controversy.
The recruitment of Cuban doctors in Uganda is not an isolated case on the continent. 100 Cuban practitioners are preparing to arrive in Kenya. They will start to give consultations in the country from June 1 onwards. The Kenyan government signed an agreement on Monday, 14 May, with the various counties of the country to share in particular the cost of this foreign workforce, which is supposed to improve the Kenyan health system. Kenya, like Uganda, is suffering from a deficit of doctors.
Victoria Namutebi is our correspondent in Uganda. Good morning, Victoria. And how is Uganda this morning?
Good morning. Uganda is very fine. It's bright, sunny, so it's beautiful. Okay,
that's very good. Sounds really good about the weather there in Uganda. Victoria, could you tell us why there is so much fuss about Cuban doctors in Uganda?
The fuss is there because majority of Ugandans, including the local doctors, are against the move. Yet government seems so determined to implement. In fact, during the Labor Day celebrations, the president himself, Yoweri Kaguta Museveni, said he's the one who came up with this idea because Ugandan doctors were striking. He described them as selfish and indisciplined. But the chairperson of the doctors, the Uganda Medical Association, Dr. Ekwaro Obuku, also says that their strike was legitimate because they raised their concerns to government first to improve their pay, working conditions, and also procure medical equipment. But oftentimes they were fed on empty promises, and this prompted the 3-week strike in November 2017 that left the common man on his knees.
Perhaps bringing in these Cuban doctors could help the healthcare sector in Uganda, but in terms of opportunity cost, is it better to hire qualified doctors rather than invest in capacity building and the provision of medical facilities?
Well, most experts argue that importing these Cuban doctors may not be the solution to Uganda's health sector because, first, if they are brought in, but there's inadequate health equipment in public hospitals, then how will they deliver? Another argument is that the move will be pricey for the Ugandan government to maintain because it will have to spend about $5,000 per doctor per month. Of this, $3,500 goes to the Cuban government directly, and the $1,500 is what is paid to the Cuban doctors as salary. So for 200 Cuban doctors, that's about over $1 million a month. Very costly for the government. The other argument, experts also talk about the language barrier. If these foreign doctors are going to work in hard-to-reach areas like government says, most of the locals there are illiterate and they may not be able to speak the official language, which unites all of us, that's English. So how will the doctors and the patients communicate? On the other hand, though, they argue that Uganda's doctor-to-patient ratio that stands at 1 doctor for 24,725 patients and 1 nurse for 11,000 patients is overflowing as compared to World Health Organization's recommended ratio of 1 physician per 1,000 patients. So this calls for more doctors. They also report cases of indiscipline, negligence, absenteeism, and corruption among the local public health workers. So who knows, the vices could be dealt with if Cuban doctors are hired. And then also government says that the local doctors prefer working in urban areas, leaving remote areas unattended too. Thus the need for hiring these Cuban doctors to work in hard-to-reach areas. So the argument is still ongoing, 50-50.
Victoria, you made mention there of the doctor-to-patient ratio, and frankly, that I must say is alarming. But let us bring in some perspective here with Kenya, which has taken this path, with Cuban doctors. In Kenya, Cuban doctors are going to earn, in fact, a little more than legislators who we already know are one of the highest paid in the world. Now has the talk on salaries started for these Cuban doctors if eventually hired in Uganda?
Yes, the talk on the Cuban doctors' salaries has started, and according to Uganda's health minister, Ruth Aceng, each Cuban doctor will be paid $1,500 a month, but the local doctors currently earn far less than that, and even their proposed enhanced salaries are also less than the Cuban doctors' proposed pay. The proposed enhancements will see local medical officers paid about $1,000, consultants paid about $1,100, senior consultants paid about $1,250, but the Cuban doctors will be paid $1,500. Now, experts say that this move might have a negative impact on Ugandan doctors, as it will leave many of them demoralized. What's important to note, though, is that the importation of Cuban doctors into Uganda is still a proposal, and it has not yet been approved by government.